There are 5 natural remedies that have been shown to help decrease benzo withdrawal if you cannot taper properly or be in a clinical setting. This is your daily dose of mental health. My name is Adam. I am an RN. I work in an inpatient setting. And in this video, we will be discussing 5 natural remedies that can help if you either can't go to an inpatient setting or if you have no option, you have to cold turkey benzos. There are five natural remedies that have been shown and proven by studies that can help benzo withdrawal be a lot more tolerable. Before I go any further, please like and subscribe to the channel. Comment, let me know if any of these things have worked for you. Because the reasons I picked some of these is because these are remedies that I've discussed with patients in the inpatient setting that said it had worked for them when they were going through benzo withdrawal or if they couldn't make it in to the inpatient setting in time. All right, let's jump right on into it. Here we go. All right, so as you can see right here, as I discussed in the last video, please check it out, what benzo withdrawal would be like in an inpatient setting. I'll put the link below. But anyway, so benzo withdrawal for people who can't be in the inpatient setting or who have to cold turkey, let's say you just run out from your connect, you're out on the street. There are ways to management and possibly reduce seizures. I am not saying it will prevent a seizure, but it can help prevent the intensity of seizures or stop them. And these are supplements that have been shown to reduce seizures. Also keep in mind how much of a benzo you were using. Some people, regardless if they use these supplements or not, would have seizures. Some people, if they weren't taking high amounts, would have seizures. Number 1 of the 5 natural remedies, magnesium. And in particular, if you're going, and it's over the counter, if you're going to buy it and you're going cold turkey, magnesium aspartate. The main reason is because it lowers the addiction intensity. And you might be saying, what do you mean by that? When you're going through those brain zaps, as we discussed in the last video, and those intense bouts of anxiety that make you want to use, or just essentially causing suicidal thoughts, that's what this does. It helps lower the addiction intensity and can help with your brain chemistry, help increase, in a way, your GAB receptors' ability to recover. So that is magnesium. And these can be bought over the counter. Number 2 is niacin. I wrote this as well because there have been multiple studies as well as magnesium that it has been shown to accelerate benzo withdrawal. So you might ask, what's the difference? Magnesium, as I said, lowers the addiction intensity. Niacin accelerates the benzo withdrawal. These two can go hand in hand. And I've seen supplements sold over the counter where it's like, oh, do the 2-in-1. Do not do that. If you're going to use them, buy both supplements and make sure, in particular, as I said, magnesium, you're buying magnesium aspartate. And with niacin, do not go to a gas station or whatnot. Go to an actual store and use the FDA-approved supplements. I mean, actually, some of them aren't FDA-approved, but use the supplements that are sold in the grocery store. And actually, some of them are FDA-approved, but look for the ones that are FDA-approved. Would be better yet. Next one, Nervine, number 3. This really, this part is, in my opinion, really key. And I didn't even hear about this until a patient, and doing some extra research, had no clue how powerful this is. Nervine is an herb that really can help reduce the sleep disruption you have. When you're going through intense benzo withdrawal, when you're cold turkeying it, as we said, because this is directed for somebody typically who is cold turkeying it, or you can't get help and you're trying to taper and it's not working. Nervine can help reduce sleep disruption. It is very hard to sleep in the beginning stages of withdrawal, of benzo withdrawal in particular. You'll wake up in sweats, you'll wake up confused, and that's never good. And if you can at least get a decent night of sleep, that will make the withdrawals, it will it'll decrease the pain that comes with the withdrawals. In general, when you're withdrawing from any substance, sleep can only help you. It can only help you because it's clearing those toxins, you're rebuilding those essential proteins in your body, those amino acids. So sleep, Nervine, another one that can help, in particular with benzo withdrawal. Once again, check out if you're curious and you don't ever have to cold turkey, and you want to know how to naturally, if you're looking to taper or if you're needing to seek help in an inpatient setting, which I strongly encourage, or get help from a healthcare professional, you should always do that. Check out my video, which I'll link below. I'll link at the very end of this, talking about the dangers of benzo withdrawal and what I've seen typically in the inpatient setting. Number 4, Kava, and this can be used as a tea as well. It can be used to reduce and prevent seizures. Now, here's the big thing. The reason why I put Kava, and I like Kava tea because it helps calm me down and it also helps decrease anxiety in general. Kava tea has been used for centuries. You can buy it, once again, at grocery stores. Kava, there are studies that have been shown, essentially, that show with all the brain activity going on in your brain when you're withdrawing, in particular from benzos, with your in your brain, with your brain chemistry and essentially your brain cells just being out of whack completely, it has been shown to help stabilize the GABA, which that is essentially what benzos do, is it attaches to the GABA in your brain, and it's a brain chemical, and that's what has helped in cause the sedation, the anxiety in the first place. And it has been shown to, when it's out of whack, to somewhat stabilize it. And once again, I cannot say for 100% on any of these that this will work for you. These are just certain things that I have seen that have worked for certain people, that patients have recommended, and also other information that I've read on the internet through viable sources showing that these can be used to help and assist. And once again, not cure. Keyword, not cure. Number 5, and I always write this is not a supplement, but staying hydrated, water, exercise, understanding what benzo withdrawal is, and support groups and online groups. I write this because staying hydrated, and in particular with exercise at first might be hard, but when you start feeling, even if you're having anxiety, like you can get out and go on walks, you'd be surprised how much just a walk or moving around will help. It helps increase blood flow to your brain and to your body, and increasing your circulation when going through withdrawals, not in the beginning, but once you hit a week or so in, can really help and decrease that anxiety, not cure it, but help at least bring it down from, on a scale of 0 to 10, 10 being the most anxiety, 0 being no anxiety. It can bring it down from an 8 or 9 to even a 5 or 6, which you say that's not a lot, but in the scheme of things, a lot of times just dropping that anxiety a little bit can make a huge difference. Another thing, and what I wanted to mention here as well is also, and I'm just going to write it right here, food. Healthy food. So healthy diet. Healthy diet is key. Vitamins and minerals. Protein shakes. At first you're going to be nauseous and not want to eat, but that's why water, getting your also electrolytes in, very big part. When you're nauseous, when you're first going through the cold turkey, and you're trying these supplements, which could be hard to hold down, make sure you're staying hydrated. A big thing is Powerade has magnesium in it. So if you can't take any of these supplements, Powerade can really help you, because it has natural magnesium in it. Now, is it magnesium aspartate? No, it is magnesium citrate. However, magnesium citrate, it branches down, and aspartate can be within it, but in small amounts. But in general, if you're staying, in small bits of trying to get these 4 I mentioned in, can really help with benzo withdrawal cold turkey, if you have to cold turkey it. And once again, I'm not promoting cold turkey. I want everyone to know that. This is just if you have no other choice and you cannot get medical help, or see a healthcare provider on tapering. Or even, let's say you've tried tapering and it never works and you end up reusing, and you've been to healthcare providers and nothing's working, then this might be routes to try. And always do your own research. And I can't say that every one of these will work for you. These are just specific remedies that I have heard from patients who have had success in their past, and from studies I have read online on this. I remember I work in an inpatient setting. I am an RN. I'm a psychiatric RN, and that is why I made this video. But check out the other one, the dangers of benzo withdrawal. So yes, these are not cures. This can just help alleviate some of the symptoms with benzo withdrawal. Because the biggest thing is, as I've said before, and which I really go in the last video about, seizures. That's why tapering is always important. Once again, thank you for checking this content out. This is your daily dose of mental health. Please like and subscribe in that bottom right hand corner. Look for more content coming out. I believe the next drug I will be covering in general is actually going to be, I think I'm either going to cover, I'm going to start covering things like, what are they called? I'm going to start covering things in particular that have to do with like different side effects from different types of psych drugs. So I might cover again, like, you know, I did a meth video. I might do amphetamine salts. I might go into video. The point is, I'm gonna continue going over things that typically are looked over and healthcare providers aren't telling you about medications that they're prescribing that you should know before starting. I know that was a mouthful, but just be on the lookout for more videos in general. And the whole point of this channel is to focus on mental health and in specific kinds of withdrawals that can happen, and specific medications that can be prescribed, that can be overlooked, that doctors don't talk to you, that don't tell you the side effects, or the pharmacists don't, and you start taking it, then you try to quit all of a sudden and you're feeling all sorts of ways. So if there's any drug you're wanting me to cover, put that in the comments. But just look out for another video in regards to, I'm going to try to cover a video a week on kind of what the withdrawal is, ways you can help assist in preventing the withdrawal, and specific side effects that are typically overlooked when taking different types of drugs. I love you all. This is your daily dose of mental health. I know that was a mouthful. Once again, please like and subscribe. I greatly appreciate it. Let's get the word out. I love you all. Peace. You all do matter. And we're going to continue this channel moving forward.